I'm Dr. Beena Green. I'm an OBGYN here at Phelps Health in Rolla. I've been practicing here for almost 7 years. Menopause is a time in a woman's life when menstrual periods stop because the ovaries stop producing estrogen. This usually comes along with some associated symptoms, and it ends reproductive years. So menopause typically begins around the age of 51. That's on average. For many women, though, there is kind of a wide range, and a lot of times people talk with their families, maybe find out when other women in their families went through menopause, and some may notice that those changes start not only because of the natural changes that occur with ovaries starting age 30s to 40s, but for some women it can be in their 40s as well. So when we talk about premenopausal symptoms, some women may start to notice some changes in their periods. Sometimes that's often when I see people coming in with these changes that could be very uncomfortable, maybe because they're heavy bleeding. It's potentially that it's irregular, it's very unpredictable time frame. So that sometimes could signify some changes that could be a sign of premenopause, but for some it's also associated with those hot flashes we hear about. Sometimes we can hear women have disrupted sleep, wake up with those night sweats and some mood changes. So I'd say a lot of times if people are curious about, does that mean this could be menopause, that's when we have a conversation in the office and decide if there should be some associated testing that could go along with that as well. For many women, we start to notice that they feel those hot flashes, which kind of feeling of flush. They can last anywhere 1 to 5 minutes. It can happen multiple times a day. I have many women come in describing different symptoms. Some are just fanning the door because they're just so hot in that moment of a hot flash. Some women also notice that they're, overnight, they're waking up in the middle, sometimes anywhere like 2 to 4 a.m. or could be any time. This can be pretty disruptive to sleep. A lot of times too, there's some associated insomnia, whether or not it's related to hot flash or night sweats. Just a little bit, the sleep pattern changes a little bit. There can also be some associated changes regarding mood, and so sometimes people may feel either a little bit more emotional or tearful. Sometimes we do have to kind of talk about if depression starts to present for women with some of those menopausal symptoms. There are also some other changes that can affect even like skin and hair, sometimes vaginal dryness, and people have noticed a lot of these changes at various times of menopause. Some women have no symptoms of menopause other than that they notice that their periods have changed. We would of course want a woman to feel very comfortable knowing that she is secure to not get pregnant if she was not planning on a pregnancy. We typically will kind of put a couple of factors together to say for sure, okay, maybe this is an okay time to discontinue contraception of some kind. Of course, that puts aside people who may or may not have had a vasectomy as a couple or having had tubes tied or something like that. But some women plan on continuing contraception sometimes because they notice that may help their menopausal symptoms, especially with the irregular bleeding. However, when menopause truly hits at that 1 year, and sometimes people like to confirm by either having a discussion with their doctor, sometimes some blood work, or having just the assurance that they're no longer having menstrual cycles, that can be a time frame to stop contraception. There are so many treatments available. A lot of times people will explore different options for menopausal treatment first by starting with some things they can try over the counter. Many women kind of seek some information or maybe talk to somebody they know about what has worked with them. Sometimes that can be something as simple as soy-based products that are eaten, as well as some natural estrogens that are just kind of available in different formulations over the counter, online, and things like that. And some women notice that this alone can be enough. Sometimes when we find out which triggers are there for hot flashes or night sweats, such as maybe potentially increased carbohydrates, caffeine, alcohol, kind of decreasing some of these things may help. Even just staying cooler sometimes can be a way to help reduce those symptoms of hot flashes. Some people keep their fan or, different ways, or even cooling pads for the bed. The other thing is if it comes to finding out what's going to help the most with symptoms of hot flashes, and night sweats, and kind of the ones that may present multiple times in a day or really become quite disruptive to a typical day. A lot of times we then have a conversation about what's going to be the most effective, and there are different formulations of estrogen and sometimes progesterone, which would be needed. Sometimes we find that that's probably going to be the most effective. Then there are also some non-hormonal options too, and that can help for women to explore different ways to control their symptoms when maybe they're not the best candidate for estrogen containing medications. And there you can even be, we look into, people can use some sprays, there are some different creams, there are some patches that can be helpful, even some internal rings people will use, different ways to explore hormonal replacement. So typically menopause really can be defined as 1 year of no menstrual periods, along with, understanding that this has naturally occurred by the ovaries alone. And that kind of gives the assurance. However, when we talk about these perimenopausal symptoms, so whether they're before or after, menopause doesn't really have a defined end time. And I know that can sometimes be disappointing when those symptoms can be aggravating, but typically about a year for truly the periods. But then if we look at the perimenopausal symptoms, that sometimes can be for many years. And some women notice that, they may talk to somebody that they know and find out that that their friend maybe had no menopause symptoms and they were done. That's it, 1 year. But some people may not be so lucky and end up occasionally having to check in for menopausal treatment of their symptoms anywhere, maybe 4 to 10 years, sometimes less, sometimes more, just depending on how they're doing. I encourage women to continue annual screening, including for whether it's cancer screening or other medical conditions, with their primary care practitioner or physician, just understanding also that there may be sometimes a referral to a gynecologist, and then we kind of look into what makes the most sense for a woman. She may not necessarily need a pap smear every year, but still we encourage breast health, vaginal health, ovarian health to be evaluated in different ways, and that can be a good discussion at the office. So I typically still recommend every 1 to 2 years. I know sometimes people explore and make sure that their insurance also allows for some of that screening with their gynecologist. I encourage women still to continue their screening, especially after menopause, for such things like we talk about cancer, but we can also talk about the bone health too. And so women in menopause can notice a decreased bone mineral density, and I know we talk about the screening needed for osteoporosis, and that is something that can be ordered by the gynecologist, potentially a primary care provider. Now, breast cancer screening should still also continue after menopause, and that can be performed with an annual mammogram. Also, we recommend whether or not cervical cancer screening is indicated for a woman based on her history, as well as potential surgeries she may or may not have had in the past. Ovarian cancer screening is right now kind of unique in that we don't have a very good, as far as outline of exactly what kind of screening can be performed. However, some women may have explored some hereditary cancer screening genes in their family and have a good plan for that. Also, a pelvic exam can be one of our better ways to be able to evaluate if something is going on, especially if there's some symptoms that have developed. As a gynecologist, we perform those pretty routinely and get very comfortable to do that and notice if there can be something abnormal. However, a woman does not have to have a pelvic exam if she opts not to after a discussion with her gynecologist. Cervical cancer screening, again, I mentioned, is a little bit more unique in that now guidelines have kind of changed, and so we kind of evaluate by a good discussion in the office whether or not it is best to have a pap smear done, and at what time she can opt to discontinue pap smear screening based on her history. So, because I've had a few conversations with patients about colon cancer screening too, sometimes people think, oh, I guess men talk about colon cancer screening. That's also something we encourage women to continue as well. So going back to cancer screening. And that of course can be performed in a couple ways, talking with primary care providers as well as gynecologists to make sure we're appropriately addressing the colon cancer screening as well.